Hi friends, this video is on the graph of strength duration curve. You know, we recently added new sections in our YouTube channel. The graph related discussions and the clinical case based discussions. Apart from that, we are uploading the MCQs on a daily basis. Plus, periodically we are also announcing the quiz contests. So, you will get the notifications if you subscribe to the channel. Alright, let's look at today's graph, strength duration curve. When do we require this, clinically speaking, this particular test or investigation or this graph? The clinical conditions will be related to the excitable tissues, because essentially the graph is about the excitable tissues, the nerve and the muscle. So what are the conditions when we require this? Conditions like Bell's palsy. After the occurrence of Bell's palsy, this investigation is done to check the excitability of the facial muscles. Certain channelopathies in which the ionic currents through the channels get altered and therefore the excitability of the tissue gets altered, or denervation of the muscles. We want to check whether there is any super sensitivity developed in the muscle. So all these clinical conditions require this particular investigation, and that is where this graph is applicable. Let's begin. The graph is strength duration curve. First thing, this is not an obtained graph, this is a plotted graph. The difference between the two should be understood. Action potential graph is an obtained graph. You apply the stimulus and cathode ray oscilloscope gives you a graphic representation of the events. So that is an obtained graph, or the flow volume loop in the respiratory system, obtained graph. This is plotted, like you take the parameters, then note down the points and join those points, plot the graph. There are two definitions, or rather two terms, one strength and two duration. What is strength? Strength of a stimulus. So we are going to apply stimulus or stimuli of different strengths. Strength, or we will call it intensity, it's used interchangeably. So stimuli of different intensities will be applied. That's strength. And the duration for which the stimulus is applied, or let's say time duration taken by the tissue to show the response. I mean, you apply the stimulus for this duration, and after that time duration the tissue responds, it excites. That's the duration. So the two terms explained at the outset. Let's talk about the stimulus first, since it's the strength of the stimulus. We apply stimulus which is classically described as a rectangular pulse. This is a representative diagram that shows you how the stimulus is applied. So on the vertical axis there is strength of the stimulus or intensity of the stimulus. You see here three different stimuli with different strengths. This is the lower strength, this is the highest strength or highest intensity of the stimulus. And on the horizontal axis there is duration, means the stimulus reached peak intensity and then it was continuously applied to the tissue, and then it was switched off, turned off. So that gives you a rectangular pulse, a representative diagram. All right. You can see here that in the first case the stimulus intensity is low but duration is greater. In the third case, you see here stimulus intensity is much higher or greater intensity, but duration is short. Point that I am trying to make is a stimulus has these two properties, intensity, that is strength, and duration for which it is being applied. And a stimulus is judged on the basis of interplay of these two properties. It's the interplay of strength and duration of that stimulus. So that is how you denote the stimuli, different stimuli. All right, so we will apply rectangular pulses to the tissue, to a particular tissue in question, and then the graph will be plotted. So you can see here on the horizontal axis there is duration, on the vertical axis there is strength of the stimulus. I think it is slightly reversed in the sense that normally we first look at the horizontal axis. So strength should have been here and its response is seen on the vertical axis. So duration could have been on the vertical axis, but nevertheless this is how traditionally it is plotted. Now let's see here, we start applying the stimulus of various intensities. We start with a very minimal stimulus strength and we apply it for quite a duration. We see whether the tissue is responding or not. Tissue does not respond. Then we slightly increase the stimulus strength, pass it through the tissue, see if the tissue responds. Tissue did not respond. Then we slightly increase the stimulus strength. Now at this stimulus strength and we passed it for some amount of time, the tissue responded. Now this stimulus strength will be called as rheobase. Rheobase is defined as the stimulus strength, minimum stimulus strength which is applied to the tissue and the tissue responds. Tissue excites, it shows excitation. And what about the duration? Duration, time duration no bar, means the stimulus can be applied for infinite duration. Duration is not the matter of concern over here. This is the minimum strength that excites the tissue finally. Below this stimulus strength, the stimulus will not excite the tissue at all. Alright, that should be understood very clearly, that rheobase means the minimum strength of the stimulus that can be applied to the tissue and the tissue shows excitation. And it can be passed, don't forget to add this, it can be passed for infinite duration, no problem. But if it is causing excitation, it's the minimum strength that can excite the tissue. And below this, the stimulus strength, any stimulus below this strength will not excite the tissue at all. Alright, so that's rheobase, first definition. And this definition is telling us about the strength of a stimulus. So that's strength. Now coming to the next part. Look, we are actually measuring the excitability of a tissue. The purpose of this entire experiment is to measure the excitability of the excitable tissues. We applied rheobase strength, minimum strength, and we allowed it to pass infinitely through the tissue for infinite time. And then finally the tissue responded. How do we judge this excitability? I mean, it's very inconvenient that you are applying and then waiting for the tissue to respond. Instead, what we will now modify is, we will apply double the rheobase strength stimulus. So this time it's going to be 2 into rheobase strength stimulus. We will apply it to the tissue and we will see how much time the tissue takes to excite. And that time taken by the tissue to excite is called as chronaxie. Okay, so that is how the experiment is performed. Let me come to the graph and then we will discuss about the chronaxie. Let's say I applied certain minimum strength stimulus, and after some duration the tissue responded. Let's say 1 unit stimulus was applied and tissue does respond, let's say after 6 milliseconds. So I mark this point. Less than this intensity and the tissue will not excite at all. So this is the minimum strength which is exciting the tissue. Now I will increase the stimulus strength and I'll pass it through the tissue. Again, I'll see how much time the tissue takes to excite. Okay, I had 1.5 times the rheobase strength, and I can see here that within 3 milliseconds this time the tissue has excited, it responded. Now I applied double the rheobase strength stimulus, and now I can see the tissue excites much faster within, let's say, 1 millisecond. I mean, it takes 1 millisecond time to excite. Now I've got these points, I join them, and I get the strength duration curve. So this is how a strength duration curve is plotted. Let's make it little clearer. Okay, the points joined and we got the strength duration curve. Two definitions required: one, rheobase, and two, chronaxie. These two definitions will be required in the exam. Rheobase, minimum strength of the stimulus that can excite the tissue when passed infinitely through the tissue. So this is somewhere here, and therefore in the graph it will be shown like this. This is the minimum strength that has excited the tissue after 6 milliseconds. But that 6 milliseconds we are not considering in this definition. This is the minimum strength, and this is called as rheobase. Then we applied 2 into rheobase strength stimulus of double the rheobase strength. Here, this is the stimulus strength, we applied it, and how much time tissue took to excite? 1 millisecond. Okay, so this is the chronaxie. 1 millisecond, that's the chronaxie. Okay, so rheobase and chronaxie. One more, sometimes you apply the rheobase strength of the stimulus and you see how much time the tissue takes to excite, and that time is called as utilization time. So this is the utilization time taken by the tissue to excite when the stimulus strength was single rheobase. It's called as utilization time. All right, so these are the definitions required in the graph. Now let's talk about some theory part. Chronaxie, I just have to reiterate this. Whenever we ask definition, student says chronaxie means double the rheobase. That's a very loose talk. Chronaxie is not double the rheobase. Chronaxie is the time taken by the tissue to excite when the stimulus strength is double the rheobase. Rheobase is what? Strength, intensity of the stimulus. Chronaxie is what? Time taken by the tissue to excite. I am just trying to emphasize it. Time taken by the tissue to excite when the stimulus strength is double the rheobase. Why did we double the strength? Because we wanted to check how much time the tissue takes to excite. All right. Okay. Definitions clear from the graph. Adding one more point here in the graph, and that is shift to left or right. If the graph shifts to the right, does that happen ever? The graph has gone like this, shifted to the right. Yes, that means you can see here, if the graph has shifted to the right, that means chronaxie has increased. Instead of 1 milliseconds, now it is 3 milliseconds. So it is taking more time to excite. You can see here, shifted to the right. This is the new strength duration curve for a particular tissue. And chronaxie, we are applying double the rheobase strength here, means from this you can drop a perpendicular. It is 3 milliseconds now instead of 1 millisecond. That means the tissue is taking longer time to excite. So let me just now clear it further. That is, chronaxie is the measure of excitability of a tissue. All right. shorter the chronaxie, more excitable is the tissue. Obviously, shorter the chronaxie means it takes less time to excite. That means it is more excitable. It is exciting quickly, more excitable, that is. And that means if the graph is shifted to the right, chronaxie time has increased, and that means the tissue's excitability has reduced. Okay, so that will happen in certain conditions, like I said, channelopathies or muscle losing its innervation, etc. Or on the other hand, shift to the left means the chronaxie will reduce in duration, means tissue will take less time to excite. That means the tissue is becoming more and more excitable. Tissue's excitability has increased. This also happens certain conditions like hypocalcemia, I mean tetany. The nerve membranes become more excitable. They excite quickly, so or they remain excitable. So that these are the conditions in which the chronaxie can get altered. That is, excitability of the tissue can get altered. Okay. Chronaxie is the measure of excitability of the tissue. We have said that already. Shorter the chronaxie means more excitable is the tissue because it is excited in less time duration. Okay. Finally, myelinated nerve has shortest chronaxie. Look, two major tissues which are excitable, they are nerve and muscle. So we are comparing nerve and muscle. Myelinated nerve, shortest chronaxie. That means most excitable among nerve and muscle, followed by unmyelinated nerve. So if we compare the two, myelinated will be more excitable than the unmyelinated nerve. And then the muscle tissue. So generally speaking, nerves are more excitable than the muscle tissue. Talking about the muscle, skeletal muscle has little shorter chronaxie, which means it is more excitable. And then the cardiac and then the smooth. In skeletal muscle, pale fibers are more excitable. Fast glycolytic fibers or fast twitch fibers are more excitable. They have shorter chronaxies compared to the red fibers, the slow oxidative fibers. They take little longer to excite. And then the skeletal muscle, then the cardiac muscle, smooth muscle. This is the order of the chronaxies, the descending order of excitabilities. Shortest to longest. Shortest, that is myelinated nerve, longest will be the smooth muscle. Now something fascinating. Which is the most excitable cell in the body? Got any idea? Most excitable cell in the body? Well, apart from nerve and muscle, there are other cells in the body which show membrane depolarization and membrane excitation. For example, receptors in the skin, they show membrane depolarization. Or pancreatic beta cell, it depolarizes and then releases insulin. Or hair cell in the labyrinth. Hair cell in the labyrinth is said to be the most excitable cell. So it must be having the shortest chronaxie, and for which reason it shows cochlear microphonic potentials. So why is it the most excitable cell, even more than the nerve and muscle? The reason is it has got highest transmembrane electrical gradient. In a quick time, let's understand. Inside the hair cell, the potential is minus 70 millivolts, the RMP, and outside is not zero like other cells in the body. Outside is plus 80 millivolts. This is called as endocochlear potential, and therefore if you see, the transmembrane electrical gradient across the membrane is 150 millivolts. If you compare this with a nerve minus 70 on the inside and 0 on the outside. Like any other cell in the body, for any other cell, the outside is taken 0 and inside is minus. Here it's very unique and special. So you can see here 70 millivolts difference across the membrane for the nerve, and for the hair cell 150 millivolts. Highest transmembrane electrical gradient, and this therefore favors the movement of cations. Therefore cations can enter easily and this or rapidly, and the cell excites very rapidly. Alright, that's the most excitable cell. And finally, clinical application of this entire discussion. I mentioned at the start, if the muscle is denervated, you would like to check its chronaxie, whether it is showing in signs of denervation supersensitivity or demyelinating disorders. The nerve was previously myelinated, now it has lost its myelin, whether it's lost its excitability and how much it has lost excitability, resulting in the features like numbness, etc. Nerve is unable to excite. Or channelopathies, certain channelopathies, and they alter the currents, ionic fluxes are altered, so the excitability will get altered. Or as I mentioned, Bell's palsy, the prognosis can be ascertained or seen on the basis of these experiments. So that was the chronaxie, rheobase, utilization time, and overall the strength duration curve.